If you're suffering from a crushed tailbone, also known as a coccyx injury or coccyx fracture, you know how debilitating the pain can be. Simple activities like sitting, standing, or walking become challenging, often forcing you to lie down every few minutes just to find relief. The good news is that recovery is possible, and in most cases you can regain normal function with the right treatment plan. In this video, we'll cover everything you need to know about how to heal a crushed tailbone, including what a crushed tailbone is, symptoms to watch for, why healing takes time, key tips to speed up recovery, what to avoid, when to see a doctor, and long-term self-care strategies. Let's dive into the essentials of tailbone injury recovery, so you can sit and stand without pain again. The tailbone, or coccyx, is a small, triangular bone at the bottom of the spine. It's made up of 3 to 5 fused vertebrae and helps support your body when you sit. A crushed tailbone usually refers to a fracture or dislocation of this delicate structure, typically caused by a hard fall directly on the tailbone, a traumatic injury, repetitive strain, or childbirth. Unlike soft tissue injuries, coccyx fractures can take longer to heal and cause persistent sharp pain when sitting, standing, or even walking. Recognizing the symptoms early can help you seek timely treatment. Common signs of a tailbone injury include severe lower back pain when sitting or standing, bruising or swelling around the base of the spine, pain during bowel movements, discomfort when transitioning from sitting to standing, needing to lie down frequently to relieve pressure, pain during intercourse, and localized tenderness when touching the area. If you're experiencing these symptoms after a fall or injury, consult a medical professional to determine if you've fractured or bruised the tailbone. Unlike larger bones, the coccyx has limited movement and blood supply. This means that healing can be slow, especially if pressure is continuously applied to the area during daily activities. Another complication is that there's no way to immobilize the tailbone in a cast like with a broken arm. As a result, the healing process relies heavily on self-care, lifestyle adjustments, and pain management strategies. Invest in an orthopedic cushion specifically designed for coccyx pain. These cushions relieve pressure on the tailbone and allow you to sit more comfortably for longer periods without worsening the injury. Products like tailbone support pillows or coccyx cushions for pain relief are often recommended by physiotherapists. During the first 48 to 72 hours, apply ice packs to reduce inflammation and swelling. After that, use warm compresses or heating pads to promote circulation and speed healing. Alternate between hot and cold therapies for best results. Try 20 minutes on, 20 minutes off cycles, especially before bed or prolonged sitting. Non-steroidal anti-inflammatory drugs like ibuprofen or naproxen can help reduce pain and inflammation. Always follow the dosage guidelines or consult your doctor before prolonged use. Natural anti-inflammatory supplements like turmeric, omega-3 fatty acids, or ginger may also support healing. Hard chairs put direct pressure on the tailbone. If you must sit, use padded seating or lean forward slightly to shift your weight onto your thighs. Alternate between sitting, standing, and lying down every 20 to 30 minutes. This helps prevent aggravation and allows tissues to heal. While rest is crucial, prolonged inactivity can lead to stiffness and muscle imbalances. Once the pain has slightly subsided, begin gentle movements like cat-cow stretches, pelvic tilts, child's pose, and glute bridges. These exercises promote circulation and prevent lower back tightness. Consult a physical therapist to tailor a rehabilitation plan for tailbone injury. Products like lidocaine patches, arnica gel, or natural pain relief patches with herbs or infrared support can offer local relief. Some new generation patches use light-activated crystals or stem cell support to stimulate recovery. Always test for skin sensitivity and read product instructions carefully. Poor posture can increase stress on the coccyx. Use lumbar supports when sitting and ensure your back is aligned when working at a desk or driving. Practice standing with even weight distribution and avoid slouching forward. If healing stalls after a few weeks, explore additional treatments like physical therapy, chiropractic adjustments, only by professionals experienced with tailbone injuries, osteopathic manual therapy, and shockwave therapy. These methods can reduce pain, improve alignment, and speed up tissue recovery. Avoid long periods of sitting, especially on hard or uneven surfaces. Don't engage in high-impact activities like running, jumping, or biking. Avoid self-diagnosing or ignoring symptoms. Refrain from applying too much heat early on, which can worsen swelling. Avoid poor posture or slouching, which increases pressure on the coccyx. See a doctor if pain is intense and lasts longer than a few weeks, you experience numbness or tingling, you notice bowel or bladder dysfunction, pain interferes with your ability to work or sleep, or there is visible bruising or deformity in the lower spine. Imaging like an X-ray or MRI may be required to assess the extent of the damage. Even after healing, it's important to protect your coccyx from future trauma. Use cushions during travel or work, practice good posture, strengthen your core and pelvic floor muscles, avoid sitting for extended periods without breaks, and address ergonomic issues in your workspace. If you're returning to physical activity, ease back in gradually and avoid exercises that place direct pressure on the tailbone. Recovering from a crushed tailbone requires patience, proper support, and consistent care. While the discomfort can feel overwhelming, especially when you're lying down every 10 minutes just to manage pain, know that many people fully recover and regain their quality of life. Use the strategies above to heal naturally, reduce tailbone pain, and get back to sitting and standing comfortably. And remember, seeking help early makes a big difference in long-term recovery. If you're looking for more resources on tailbone pain relief, natural healing methods, or posture correction, subscribe to our newsletter or explore related blog posts.